Okay. I do see here something that definitely warrants us to investigate and do some tests. I'm going to take a sample, and we definitely need to send it to the lab to check. Alright, this one definitely not hurt, but I'm just going to have to scratch your scalp so that we remove some of those cells. We need to make sure that we have enough sample so that we can send it to the lab. They're going to do the research and figure out exactly what type of scalp infection you have, and then we're gonna know which targeted treatment we need to follow. So we're doing 2 samples. One is for gram-negative bacteria. Alright, we're going to do some tests here. I just want to make sure that there is no sensorial compromise. Can you go ahead and tell me how many pressure points you feel? 1 or 2?
2. 1. 2. 3.
Okay. Does this feel cold or warm?
Cold. 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 Warm.
I'm going to touch you with 1 or 2 pressure points. Go ahead and tell me if you feel this 2 or 1.
1. 1. 1. 1.
Okay, so as we move a little bit deeper, there's definitely a level of compromise. Go ahead and tell me if you feel this pressure point right here.
Yes.
And here.
Yes.
What about here?
No.
Okay, so as we move a little bit higher. Now I'm going to touch you with 2 textures. One is going to feel sharp, the other one is going to be dull. Go ahead and tell me if you feel this sharp or dull.
Sharp. Sharp. Dull. Sharp. 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 Dull. 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 Sharp.
Okay. Let's go ahead and check your left side now. let me go ahead and use the light here. So we're going to visualize the hairline. We're looking for signs of alopecia, usually around the hairline. There you go. We saw a little bit of, this is like the beginning. I would recommend a castor oil here. It definitely helps to reduce inflammation in this area. And it'll help to stimulate blood flow, and the hair is just going to start growing a lot faster at a faster rate. Okay, I'm going to do some tests here since I'm noticing a little bit of beginning of alopecia as well. So this is gonna be a little bit like a stinging sensation since I'm applying some solution with magnesium in it. It really does help to relax the muscles of the scalp. And right here, I'm also going to apply a little bit of acupressure to these points. Helps to stimulate blood flow. Good. Okay. Okay. Now go ahead and tell me if you feel this 1 or 2 puffs of hair.
One. One. Two. One. One.
Okay. I'm going to take another sample here. Okay, this should not hurt at all. What you're going to feel is just a little bit of pressure around the follicle, because what we're doing is to stimulate the nerve endings so that they receive negative impulses that will allow for an exchange of neurons. Definitely it will help with hair growth and your sensory to become again normal. Okay. Just going to move a little bit higher here, and we're going to do some sensory tests. I'm not seeing any redness, so it seems like the infection is only at the base of the skull. Go ahead and tell me if you feel this sharp or dull.
Sharp.
And does this feel sharp all the way?
Yes.
Okay, tell me how many times you feel a sharp, pointy object touching you. 1 or 2?
2. 1. 2. 2. 1.
Okay. Now, this is going to feel kind of like a sharp, pointy pressure. Go ahead and tell me if you feel this, yes or no.
Yes. 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 Yes.
Okay, go ahead and tell me if you feel this cold or warm.
Cold. Warm. 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 Cold.
Okay. There's definitely a problem there. Go ahead and tell me if you feel this sharp or dull.
Dull. Sharp. Dull. Dull. Sharp. Sharp. Sharp.
Okay, now we're moving to the point of alopecia. Now we're moving to the point where we saw a little bit more of alopecia, so the patch seems to be on a greater surface. I'm going to examine it first with the light. There is no redness, I'm not seeing any vesicles, and we still have to take a sample here. This is gonna feel a little bit on the dry side, so I'm gonna have to scratch the scalp so that we can remove those cells that need to be tested. I'm gonna use the comb to separate the hair. Are you having any itchiness or burning sensation around the hairline in the front?
Sometimes itchy. Very itchy.
And there's no sign of any parasite infestation. We are definitely ruling that out, but there is an infection that seems to be spreading, and we need to catch it on time so that it doesn't spread in other parts where it can affect the hair growth. Okay, we're going to move to the right side. So I'm going to just rub the left side a little bit so that it doesn't interfere with the work that we have to do there. I'm definitely noticing the same beginning of alopecia that you have on that side. There's also a scar here, so we're gonna have to definitely sample that as well. And the redness seems to be a little bit diminished on the right side, which is a good sign. It means that it didn't have time to spread everywhere. I'm going to do a sensory test over here. Okay, looks like the site is good to go. Can you please tell me if you feel this cold or warm?
Cold. Warm. Cold. Cold. Warm. Cold. Warm. Warm.
Okay. And go ahead and tell me if you feel this pressure point. Yes or no?
Yes. 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 Yes.
Okay. And do you feel this 2 or 1 pressure points?
1, 2,
Good.
2,
Good.
1,
Okay.
1.
Okay. Now I'm going to touch you with 2 textures. One is going to feel sharp, the other one is going to be dull. Go ahead and tell me if you feel this sharp or dull.
Dull. Dull. Dull. Sharp. 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 Dull. Dull. Dull.
Okay. And do you feel this bubble there? Yes or no?
No. No. Yes. No.
Okay. Most definitely. We're gonna have to do more tests. Okay, so what I'm going to do now is we're going to work on increasing blood flow, mainly to the base of the skull. I do have a few treatments that we can try. So first we're going to work on the hairline. And this will help to increase blood flow to the occipital lobes. pressure. This helps to reduce this. I'm going to apply a little bit of acupressure. This helps to reduce lymphatic fluid. So you're going to see a decrease in that puffiness and inflammation. I'm also going to prescribe some castor oil that's going to be medicated with antibiotics. So we're working on lymphatic drainage that helps to reduce fluid and inflammation in this area. Drinking a lot of water definitely helps after this session to remove those toxins. I'm going to apply a low dose of castor oil. Just massaging it really well to make sure that it penetrates the scalp. And I'm going to perform hair pulling. It's going to help to allow the castor oil to penetrate even better. Any pressure here as I'm pulling up?
Just a little.
Okay. So we finished today's treatment. I'm gonna see you back in about 2 weeks to see how the castor oil is working for you, and I'll call you back with the results from the test. Okay, I'm going to divide the scalp area into two main parts. Okay, perfect. Now I'll take a look at the right side. And I want to see if there is any dryness, any scalp conditions that we are working with. And then we're going to do a full scalp treatment. Probably I'm going to take some samples so that we can figure out exactly the type of scalp type that you have. You've been having a little bit of dryness and itchiness, correct?
Yes, it's been very itchy.
Okay. So I'm going to apply a basic solution. This helps to lower the acidity of the scalp so that we can take a proper sample. going to send this to the lab. Take a look at the hairline. Noticing a little bit of swelling around the neck. So I'm going to apply an anti-inflammatory oil. That's going to help to lower inflammation. This is going to feel a little bit cold. going to apply this along the neckline. I'm going to perform hair pulling therapy. I'm going to move the left side. especially around the ear. We have to make sure that there is no inflammation. Scalp looks very clean and healthy. What I'm gonna do is I will do a test for a vitamin deficiency, and if needed we're going to prescribe some medication that will help with hair growth. This solution helps to prepare the side so that we can do a proper extraction. going to send that to the lab. Then we're also going to do hair pulling therapy to make sure that we are increasing blood flow to the scalp. It also helps to reduce tension and reduce scalp tenderness. session. Thank you for allowing me to take care of your face and scalp.
Thank you.